House Republicans released their bill to repeal and replace former President Barack Obama's health care overhaul, commonly known as Obamacare. The new proposal, called the American Health Care Act, scales back the government's role in helping people afford coverage. If passed, the measure would block federal payments to Planned Parenthood for 1 year. It would also stop people from receiving tax credits to help pay premiums for plans that provide abortions. Joining me now is Marilyn Musgrave, a former U.S. representative for the state of Colorado and the Vice President of Government Affairs for the Susan B. Anthony list, the pro-life group we're teaming up with for this program. Congresswoman, thank you for being here.
It's good to be here.
So what do you make of this plan?
Well, I'm encouraged. Here the news is rolling out about what the House is doing. And of course, our main concern has been that Hyde protections, no taxpayer funding of abortion in the replacement of Obamacare. So there's a long process ahead, but the information started coming out and we're encouraged by what we see.
You all have been calling for the protection of taxpayer dollars for a while now. Tell us about that coalition letter.
Well, amazingly, I mean, when do you have a letter signed on by 60 pro-life leaders saying, Congress, we're telling you, we expect you to have Hyde protections in the replacement of Obamacare. So I think that letter in itself is remarkable, and the pro-life community is saying we do not want American tax dollars going for abortion, and that really reflects the will of the American people.
Congresswoman, can you remind us, back in 2010 when abortion funding became an issue when it came to Obamacare, remind us what happened then?
Well, those days are so memorable to me because the very issue that could have stopped the Affordable Care Act, Obamacare, was the abortion issue. And we had pro-life Democrats. You know, we have lots of pro-life Republicans, but it seems like fewer and fewer Democrats. But Bart Stupak and a number of other pro-life Democrats were saying they would not vote for the bill if it had taxpayer funding of abortion. Well, it was heartbreaking to see them cave on that with the executive order that was offered to them, but that is why Obamacare passed with taxpayer funding of abortion, the largest expansion of abortion since Roe v. Wade. It was a very dark day.
So what should congressmen today take from that if they're thinking, you know, when it comes to voting for this bill?
Well, fortunately, we have great friends in leadership, but they know that they will be held to the very same standard as Republicans that the Democrats were held to back in 2010. And after those pro-life Democrats caved, 15 out of 20 were not reelected to office. One retired. So it had a very significant impact on them politically because people do not want taxpayer funding of abortion.
As a former legislator yourself, what kind of timeline do you see on this? And is it going to take very long?
Well, it's going to take a little while because it has to go through the committees, then it has to go for a vote in the House after the Rules Committee, and then it has to go to the Senate through a very similar procedure. But over there, because this is reconciliation, it's a budget issue, it can pass with 50 votes. And so that's very important because there are not 60 pro-life votes in the United States Senate right now. But you know what I would say as a former member, when people contact your office, it does make a difference. And when a number of calls are coming into your office over an issue, you pay attention, your staff is paying attention. So I would tell everyone out there, stay engaged because every step of the way, we could have something happen here. And we do not want to have taxpayer funding of abortion in this replacement. And we have to make sure that we do our part every step of the way to give elected members of Congress, representatives and senators that message loud and clear.
From the mouth of a congresswoman herself, grassroots matter. Thank you so much for being here.
It's good to be here with you.